Good evening, everyone. I'm delighted to be introducing one of our alumni, Mr. Michael Delaney, for the DeMatteis School Executive Speaker Series today. In the wake of the current COVID crisis, safety is top of mind of everyone as they look beyond the current shelter-in-place mandates toward the recovery period when they can resume traveling. And leisure travel is, after all, is an experience that consumers have historically associated with having fun, especially something they usually plan for the summer to go away with their family. But under the current conditions, layered on top of that expectation of having fun is also the expectation of protection. And travelers want to be informed about what travel industry is doing to improve their safety standards. And we are delighted that today Michael will go over some of these options which are taking place in order to restore confidence in air travel. Mike Delaney currently leads Boeing's Confident Travel initiative to help the aviation industry's safety resume global air travel amid the COVID-19 pandemic. He is also the Vice President of Digital Transformation, a position he was named in September 2017. Previously, Mike was Vice President and General Manager of Airplane Development, and in that role, he was responsible for all commercial airplane development programs at Boeing. Mr. Delaney also served as the Vice President of Engineering for Commercial Airplanes, where he was responsible for product development, design, delegated compliance, certification, and safety activities for all commercial airplane models, their derivatives, and post-delivery upgrades. Prior to his engineering leadership role, Michael Delaney was Vice President and Chief Project Engineer for 787 program, leading the readiness effort for the first airplane delivery, technical configuration, and product integrity and safety. Mike Delaney earned his bachelor's degree in mechanical engineering with concentration in aerospace engineering from Hofstra University in 1985, and a master's of business administration from Toulouse Business School in 2001. He was named a fellow of the American Institute of Aeronautics and Astronautics in 2013, and Mr. Delaney currently serves as the member of the DeMatteis School Dean Advisory Board and Hofstra University Board of Trustees. Mike.
Thank you, Dean Rubini. Can you hear me?
Yes.
Okay. Well, welcome everyone, and thank you for taking some time out of your evening in New York. I'm in actually very sunny Seattle, and it's a mid-afternoon here. So what I thought we'd do is spend about a half hour talking about what we're doing in our Confident Travel initiative. And think about it this way: we have one mission. We have 3 strategies to implement that mission. We have 3 time horizons that we're working against. And we have 3 work streams of work going on to support that. And that's what I'm going to talk to you about today. And so with that, just to set some context, and I don't think people realize that how severe the impact of COVID-19 is into our industry and to the economies in general around the world. But you can see that the industry has basically, at the height of the COVID pandemic, 80 to 90% of all air traffic was wiped out in the world. And today we've started to see a resurgence in the last 30 to 45 days. And the world is only flying at 30% of the passenger load or revenue kilometer passengers that we were flying 1 year ago. Some areas like Africa have still stayed fairly depressed. China, one of the earliest areas with the outbreak, has started to recover a little faster than everyone else. And you can see that North America has started to uptick in the last month. But you can also see that early 2020 was another great year for the industry, or was looking like being another great year for the industry, as North America in the early months of 2020 We're already 20% greater travel capacity and travel miles than the previous year. And so this is really the challenge, is how do we restore confidence that people can get back to using airplanes in the air travel system to go where they want to go, to do business, to visit people, to live their lives. We have some historical trends. If you look, this puts it in context. This goes back to about 1980, but the trend goes all the way back to the 60s, that air travel has grown at about 5% growth per year, year over year. Now, the blue line is the trend line and smooth. The dark blue line is the actuals. And you could see a couple of disruptions there. The first one is actually September 11th. And September 11th was, at the time, the worst exogenous event that happened to the industry in my 32 years in the aerospace industry, almost 35 actually now, but 32 in the commercial industry. And it took 3 years roughly to recover. And in context, it was but it was hard. And then you could see a few years later, we had the first COVID-1, or what was commonly called SARS. The North America and Europe didn't take as big a hit, but Asia took a pretty good hit. And it took 2 years for the world to recover back, come up to the trend line. After SARS, the industry, as you could see, was growing at greater than historical trends of about 6% for the last 10 years. The blue dotted line is the estimate of what most people think is going to happen, and that 2020 will end roughly 50% down from its previous year. And then it could be, we've seen estimates of 3 to 4 or 5 years for the traffic to resume. So a massive economic loss as well as disruption to people's ability to travel around the world. And that was really the context that we started and said, okay, it's in our interest, in the interest of the world's economies and the American economy for us to take on an initiative to sort of help figure out how we can get people to feel confident and understand the risks of flying. So we sat down and we laid out a strategy, and it really is, the mission is to restore confidence in air travel through global efforts to provide flyers the safest, healthiest travel journey possible. And really, when you think about it, and we'll talk a little bit more about this when we talk about some of the strategies and tactics, flying, like any activity, will never be zero risk. And what we want to do is people understand that you can be as safe as you possibly can be on an airplane from an average risk, understand the specific risk, understand the things that you can do to fly and safely fly. And we think that the air travel journey is actually, and we're looking at it through data and modeling, as safe or safer than anything you would do in your everyday life. Now, Sina talked a little bit about my background, and I was chief engineer of the 787 through first flight and head of engineering for commercial airplanes, but I was also chief engineer of the 737 a long time ago. And as a chief engineer, how you think about airplanes is you evaluate and assess threats. And so if you think about it, an external threat to an airplane might be a lightning strike. It could be wind shear. Internal threat to the airplane could be malfunction or cessation of function. And as an engineer, you design to minimize those threats and risks to the airplane. And so let me give you an example of that. If you were to understand, one of our primary design rules of airplane design is that if an airplane is structurally sound, it must be controllable. So that then, as a chief engineer, says that an airplane of the size of a Boeing commercial airplane or Airbus airplane can never lose hydraulic power. Now, we know through service experience that hydraulic systems fail at about 10 to the minus 3 or 10 to the minus 4th rate. And to hit a level that never fails would be a probability of less than 10 to the minus 9th. So all modern airplanes have 3 hydraulic systems because you get to multiply. 3 times 10 to the minus 3 gets you to 10 to the minus 9. That's how you solve, one way of solving your risk and threat analysis on an airplane. Another way to do it would be to provide an independent layer of protection. So, for example, after TWA tragedy happened off Long Island, the industry looked at how we dealt with ignition sources in tanks. And you almost got to the point where you had to prove a negative, where how could you ever prove or justify that you had eliminated all ignition sources? So we did a different activity. We put an independent layer of protection called flammability reduction, where we inerted the tanks of the airplane. So those are strategies that you would apply as a chief engineer to deal with a threat. So thinking about COVID as a threat to the airplane, we sat down with our team and said, okay, what would be a multiple layer, independent layer strategy that we would take to protect an airplane from COVID like we would any other threat to the airplane or the passengers? And the first one would be, we came up with, was we need to do everything we can to keep the virus off the airplane. And that's the whole travel system. So the flying experience is just not the time you spend in the airplane, but it's when you leave your house, whether you take the mass transit, if you take the JFK shuttle to the JFK, or Uber, or take your own car. It's the shuttle from the parking lot to the terminal. It's checking your bags. It's going through TSA. It's getting a cup of coffee at Starbucks. It's waiting in the gate, boarding the airplane, flying, getting off the airplane, picking up your luggage, taking a taxi to your hotel or home, wherever you're going. So that whole system needs to be protected. So it is a complete value stream that has to be looked at. Now, we have the most knowledge about the time when you're on the airplane, but we work with a lot of other people who do, like airport authorities and airlines, who do control some of the other elements of the flying journey, and we're doing that. The second thing is, what do you do to keep the airplane virus free? And this again is, you think about it, how we maintain an airplane. For those of you that are not in the aerospace industry, we tell the airlines how to do a task. That's what's called the maintenance manual. And we tell the airlines the frequency that they need to do the task, and either the process by which they need to do it or the inspection by which they need to do it to ensure that it's airworthy. That's called the maintenance planning document. Those 2 documents are generic from Boeing, and then airlines can tune those for their own operations. Some airlines choose to do it overnight, break it up each night. Some airlines decide to do it once every 3 months. They're all legitimate. You just have to juggle the equation. So what we want to do by keeping the viruses off the airplane is come up with what we call a clean airplane program, which gives the airlines the ability to think about the cleaning process. So, and in aerospace we use, and it's probably similar in other industries, but we have 2 processes. We have cleaning and disinfecting. Cleaning is when you remove something, so you remove, in this case, the virus. Disinfecting is when you apply something that basically kills the virus, or renders it, inert. And so we want to be able to put together a program that says, okay, there's commodities on the airplane. So think about seats, leather and cloth, seat belts, tray tables, windows, armrests, lavatories, galleys, flight deck, stow bins. And those are different materials. And we want to be able to give the airline, say, here's a list of cleaners that you can use, or other ways of keeping it clean. And if you do this, you can structure a program. And ideally, because we know that all airplanes don't operate the same. Some 737s have to fly 7 to 10 times a day, some even more, with 30-minute turn times for the airline's operation. So if Boeing were to prescribe a 2-hour cleaning regime, that wouldn't work for a business model like a Southwest or a Ryanair or somebody like that. Whereas a large international carrier where an airplane flies twice a day, there's 4 to 5 hours between flights. Obviously, that you could deal with a different prescription or cleaning that airplane. And then the third strategy is reducing the probability of transmission while people are on the airplane. So we're actually looking at, we assume that there's an index patient on the airplane. They could be symptomatic or asymptomatic. And we assume there's a viral shedding load. And we look at what is the probability that the people around them will be exposed to a viral load that could lead to transmission. And the biggest thing that helps contribute to that is the actual capability of the airplane itself when you're on the airplane. The environmental control system, what we call ECS system, layman's terms, the air conditioning system on the airplane, is very different than anything you will see in buildings or your daily life. And I'll go through a little bit later on that. And so we can give the airlines guidance as to settings on the air conditioning system that minimize the possibility of transmission from passenger to passenger. The other thing is the airlines can do things like, some airlines are boarding from back to front now. Airlines have changed their service offerings, the interactions between the crew and the passengers. You know, one of the hardest areas is the lavatories, because it's a common area where lots of people tend to go. And so we're trying to work with the airlines to understand how that they can keep the lavs in a condition that would prevent somebody from transmitting the disease. Now, the 3 time horizons that we're looking at is, the first time horizon is really 0 to 90 days, which is get the world flying. And that was really responding to the airlines' questions like, what is an effective agent to use in the flight deck? And in the case of the flight deck, it's only isopropyl alcohol, 70%, because other things are corrosive to the sensitive electronics in the flight deck. Whereas in the cabin, where you have leathers and cloths and other materials, plastics, you have a larger range of disinfectants that are available. Now, we don't test for efficacy in the Boeing company. We rely on the guidance from the EPA, who gives us efficacy of the cleaners that we recommend to the airlines. Now, the second phase of this effort will be around what we call stabilize. So as I showed you, some of the airlines in regions of the world are starting to recover. And many of the airlines today can deal with the cleaning regimes that they've implemented, some of the social distancing requirements they've implemented in the gate area and other parts of the airport. But when the airlines are flying at 20% capacity, that's manageable. You know, the air traffic system was running high 80s to low 90% load factor at very high frequencies prior to COVID. That is when the system will get really, really stressed. So we have to be looking around the corner to the recovery, and the things we need to be implementing need to be able to be executed for the rates and load factors and frequencies and turn times that people are going to be experiencing as they recover. And then long-term, we need to be able to allow that long-term trend to recover and the airlines to meet their productivity and economic requirements, because, you know, various studies, it's a fairly significant load factor that most airlines need to be profitable. And in the long run, they have to be profitable. The answer of flying at lower load factors or things like blocking middle seats, we already know from years and years of study that air travel is very elastic, and $1 in ticket price is a fairly large difference in demand. So clearly we can't have airplanes that are flying at 50% capacity long-term and have the fares sustainable to what people are willing and capable of paying to fly. So we have to get the productivity back into the way the airplanes were designed from a seat and trip cost. So that's the first one, and then the 2 3s. And then this is a different view of a little bit of what I was just talking about, which is the 3 horizons of what we're trying to do. But then I said the third 3 was the work lanes and the work streams that we're working on. And the first is around the Sanitize the Airplane and the Clean Air program. The second, which I'll introduce now and I'll talk about a little bit more detail, is the probabilistic modeling. So I talked a little bit about it earlier, and I apologize for any of you that are not aerospace engineers and don't work in hazard categories in 10 to the minus 9th and 10 to the minus 7th type numbers. But, you know, we look at things from a probabilistic point of view. The entire air transportation system is assessed based on what's called general risk. We then learn and understand what happens through time through specific risks on the airplane. And what we're trying to do is create a model, a similar thing that says, okay, two things. What is the probability of transmission in the air transportation system from the time you leave a house to the time you get to wherever you're going, hotel or back to your house? And then the second thing is, what's the risk when you're in the airplane? And so we want to do that for two reasons. One, and we're trying to think through, and it's part of why we want to have some interactions with some of the medical community, including with Hofstra's medical school. When you talk to the epidemiologists, they talk about the replication factor of a disease, or an R-naught. That's a very similar kind of thought process to what we do in a probabilistic of an airplane. And so what we're trying to do is understand, can we understand the R-naught of the travel experience versus the general experience? And we believe that if it's less than 1, that ratio, it's as safe or safer to be flying as doing any other activity. Now we have to go prove that through modeling and simulation and get good peer-reviewed data for our models. And that's going to be one of the hardest part, because most of the models that you see on TV that are and some of the early guidance from CDC and others really came from their knowledge of influenza A and SARS-CoV-1. The real data, how much is fomite, how much is airborne in COVID-19, is just starting to be understood. So those probabilities that go into the model clearly have to be peer reviewed. And that'll give us, why that's important is it allows us as Boeing not to pretend we're doctors, but to work on the strength that we have, which is analyzing things from aerospace principles and practices. So when somebody says, I was on a phone call with somebody recently, and they say, well, we just have to do something like block the middle seat in a say a 320, a A320 or a 737. And I said to the person, based on what data? I don't know, but we just have to do something. And I said, well, that's an emotional decision. I said, why do you think that seat is different from the one that's 17 inches away or 20 inches away on the other side of the aisle? Whereas I can show you by modeling and particle distribution what's really happening, and we can understand the risk that you're taking no matter which seat you're in or how many rows forward and aft. And that becomes important, because on the other side of when you make emotional regulation is, how do you undo it? And whereas if you make a decision based on data, you can make a decision to undo something based on data also. And that's what we're trying to drive, and that's the way we make all the decisions. That's how the airplane industry has become the safest mode of transportation we have. And then the third layer is really, we have to restore confidence. And here's going to be the trick that we have to think through, or the way you're going to have to discuss it. The airplane industry, like anything, is an average risk, right? The risk of an airplane crashing is certain per million departures, right? Everybody knows that there's a risk, right? And even if we come out and model and say, here is what we believe is the safe environment and why it's safe, and it's very logical engineering, you are still going to have people who have a specific, they say, I understand when you talk about 1 million flights and 10 million people, but what about me when I'm sitting right next to this person who's coughing? What happens to that? That's the specific risk. And that is absolutely true. And we have to be able to have that conversation with people. And so if you're healthy and have no underlying comorbidities, and you wear a mask and you use hand sanitizer and take the appropriate risk, you're probably not any more risk than you are doing anything else you have. But I had somebody when I was briefing the National Academies, I'm on the National Academies, one of the boards, and this person said, but I have immune challenges. And I said, well, then you have to really think about not only the average risk, but then on top of that, your specific situation and risk. So you will never hear me say, it's okay, everybody just return to your normal life. That would be irresponsible. And so I don't want people coming off with the message when we say Boeing is trying to model how safe it is to fly on an airplane. We recognize that there's an average risk, and then there is a specific risk, and there's individual decisions that people will have to make, and then individual responsibilities that people will have to take, like wearing a mask and using hand sanitizer. I mean, I flew at the height of the COVID in Washington State between here in Arizona with my family, and we talked about it, and we said, okay, we understand the risks. Now, I understand the airplanes a little better than maybe most people, have a little inside knowledge, but we wore masks, and we took hand sanitizer, we brought our own food on the airplane, and we were careful, even though we knew we were all healthy and had no comorbidities, but we were still took precautions and took responsibility for how we assessed the risk and went on. And that's how we want to think about it. And that's really more the conversation, as opposed to sounding, I would say, disingenuous and saying, don't worry, it's okay, it's safe. I think it is safe as other things you do, but you have to understand the risks and understand your own personal specific risks. So let's dive down a little bit, and then we'll go to questions. I've talked about this. This is the entire journey. We're dealing with the first couple and the last one with the off the airplane strategy, keep the virus off the airplane strategy, the airplane clean in the center and the disinfecting strategy. And then obviously I talked a lot about the in-flight strategy, the air conditioning system, how service is done, how the airlines have adjusted their models. And I'll just try to pick up some time here. This is just for your interest. I mean, here are some of the things that we're doing. I mean, with the airlines, and clearly this is, you see, people are wiping it. It's labor intensive, so airlines are now looking at things like electrostatic sprayers, where you electrostatically charge the cleaner, and then it actually clings to the surface and then has the dwell time it needs, and it's a much more efficient way to clean a cabin very quickly. We're also looking at things like ultraviolet light. We'll talk about that and some of the research we're doing there. The other thing that we have is two things available to us. One, there are antimicrobial coatings. I think there's a slide further on. And then we're looking at nanotechnologies where the antimicrobial characteristics are actually built into the part and into the material itself. Then this is interesting. People are always fascinated about this. This is what the air system looks like on an airplane, and how it works is, this is a wide body or twin aisle airplane, and there's two areas where the air enters the cabin on each side. And what the air does, it's an aerodynamic funnel where it entrains and basically works up along the ceiling of the airplane, meets in the middle of the airplane, and then comes down. And it's actually a very unsteady aerodynamic phenomenon. So if you watch the CFD of it, it actually wiggles around a little bit. And then the air comes down, fundamentally ceiling to floor, and then goes outboard. If you ever look on an airplane, there's grates or grills down by your ankles. That's actually where the air is leaving the cabin. And there is some slight recirculation so there's no stagnation and even temperature gradients. Now the airplane, there's very little fore to aft flow in an airplane, in any of the airplanes, ours, Airbuses, Embraers. And that's by design and originally it was for air quality and comfort. But when we look at it from the threat of COVID-19, it's actually a very good air system to prevent the spread of molecules. And And people, you would not, I don't have them in here, but people worry about people sneezing a row behind them. And you'll see these, sometimes these dramatic CFDs from professors who publish things. And what you'll wind up, when you're actually in the airplane environment, within one seat row, that you can't see it. And it's, so the airplane behaves very differently than what you would see in a restaurant or an office building or an elevator or some other environment. And the other thing that happens is, what most people don't realize is the air conditioning system on an airplane basically provides about the equal volume and mass flow to the entire cabin in about 2 to 3 minutes. So the air exchange rate is about 20 to 30 times an hour in an airplane, and whereas buildings are significantly lower than that. And then the air about half the air comes from the outside through the engines, and then about half the air is recirculated, and the recirculated air goes through a HEPA filter that takes about 99.9% of all the particles out of the air, including the size of viruses. And COVID is actually in the normal virus size. I think it's 1.0 to 1.2 microns. And so the system on the airplane is very different than anything you see anywhere else. And it's actually wasn't designed for this, but it actually works really well for giving it a layer of protection. The other thing I talked about, this has a lot of opportunity, mainly to reduce burden, is antimicrobial surfaces. They don't kill viruses instantly. That's one. They do take some time, but the way the surfaces are promotes fast extinction of bacteria and viruses. There are off-the-shelf sprays, and then, like I said, there's some nanotechnologies that we're looking at that embed it actually into the part so that you wouldn't have to keep recoding it. I'll just touch this for the math and science, computer science and engineering folks in the crowd. This is a very simplistic of the model, where we look at the inputs, and like I said, a lot of the data we have today about the probability of, say, airborne spread or fomite spread, we get from CDC through their peer-reviewed data. It is today still mostly based on influenza and SARS, but we are getting some updated information. And we also understand like I just showed you, the environmental control system on the airplane. We understand the materials. We also, the one thing that flying has that the general public doesn't have, when you go through the passenger selection model, two things: severely symptomatic patients probably aren't going to fly, but they are going to probably go to the pharmacy or some other places potentially that you might run into them in everyday life. The one thing that's tough with this disease or this pandemic is the number of asymptomatic folks. And then there is some data we're getting from some of the medical community that says some of the most, your most contagious about 0.6 days before, for those that become symptomatic, about 0.6 days before you become symptomatic, you're actually at one of your highest viral shedding loads. So that's not working in our favor. And then you look at, we understand that some of the, we don't understand. I said we have information and we're trying to understand all the transmission modes and models. And then what we really want to do is two things: understand, like I said, the total journey, but then really the green boxes below, understand what happens when we introduce a countermeasure. And we've done that where if you are, we've modeled part of a 737, and if you put an index passenger in, just adding masks and hand sanitizer is basically 2 orders of magnitude drop in particles and risk. So it's a very, very effective countermeasure. And we want to be able to model that so people understand we're not just saying Boeing believes you should wear masks flying because we're trying to CYA. We believe it because the data tells us it's an effective countermeasure for spreading and being infected. And I hope that would be concurred with by the medical community and some of the hospital data. And then we're trying to drive recommendations to the airports, to the airlines, and like I just talked about, to the passengers. You could just see these are some of the countermeasures, just a graphic of some of the countermeasures that we're testing. We're actually doing some testing with some. Basically we're thinking about testing with an inert viral load that's approved by the Defense Department and the EPA, where we can assess the effectivity of cleaning and some of these countermeasures. So that way we can assure by process that what we're doing is the right thing for the flying public. And then to actually go down, if we're actually been working with some of the community to CFD, and one of the things that's really important is not just wearing a mask, but wearing a mask properly. And I know you see a lot of people where they wear the mask over their mouth, but they don't wear it over their nose. And if you don't wear a mask properly, you really undermine the countermeasure and the protection. This is just some stuff that we're doing long term. Here's some interesting work we're doing, part of it with Columbia University in New York. Lots of people know that ultraviolet is very effective at killing viruses. You can buy UV products, antiviral products on Amazon. Most of them are in the UVC range, which is 254 nanometer. You know, there's the trick with using UV is it's the power and the duration. And if you want to be able to kill something quickly, like when on a turn time of an airplane, the power has to be high if you want the duration to be low. One issue with the UVC band is you have to wear PPE or personal protective equipment because of its effects to skin and membranes in your eyes and things like that. There is a far field wavelength of UV 222 that looks like, and this is the work we're doing at one of the universities, that it could be human safe without PPE, but we have not finished that work. That would be helpful because then right now, if we were to deploy UV, you would not be able to have passengers or cleaning people on the airplane when you were doing it, or they'd have to have PPE on it. If you could get to a place where you had a safe wavelength that had efficacy, then there would be an opportunity to again, for efficiency and the ability to be productive. And then these are some sketches of what people are looking at. You know, some of it is the thermal scanning for temperature. Clearly, one of the areas that people are most nervous is about going to the lavatory. So even what simple things like people don't want to touch the latch to open the door or lock the door. And so we're trying to work with our airlines to figure out ways that you can have touchless access. And the same way a lot of the airlines are trying to make the experience through check-in, a lot of the US airlines, if you've flown, are highly recommending that you download the app and you do all your interactions with the airline through your phone, as opposed to through the kiosks or meeting with an agent, unless you have to. And ideally, we'd like to be able to do things like that on the airplane. Now, those are harder because they have to be type certified and incorporated in. There's 13,000 Boeing airplanes in the world today flying commercially. So that's not a fast thing. And then the other thing is people want to be assured that in between passengers that the lav is clean and that they're going to a common area. And so that's probably going to be one of the biggest challenges in the confidence, is understanding how it is, particularly on the longer haul international flights where you are going to be using the lavatory, you are going to want to be up and about, and you're going to want to interact with the airplane as much as just get on an airplane and go, like if you were doing a 2-hour flight or a 1-hour flight. And then, this is not a Boeing alone. We're working with Airbus, we're working with Embraer. We have to do that through agencies like AIA or ICC AIA, who are overarching industry organizations. We're working with IATA and ICAO, World Health Organization. I've met with the CDC, obviously the FAA and others in our government and around the world. as well as the airlines industries like A4A and A4E. And so this is not only Boeing. We are collaborating. We've taken the position that we're sharing. So we've told people, our partners in the industries, we'll share our model, we'll share our assumptions. We were talking to academia and others to try to make sure that we have the best information. And it's really about helping people get back and flying as opposed to some competitive advantage or intellectual property play. And with that, we are telling our story. Whether you know it or not, my comms person and I redid the whole thing today, and you're one of our guinea pigs about our presentation and how we're going to tell our story. So thank you very much in advance for helping us out, and we'll appreciate any feedback or questions you have. And then the last thing we're doing is you can go to this. There's a website. If anything I've talked about or other things that you're interested in is available for our airlines and for the flying public to go look at everything we're doing. We're trying to be as transparent as possible and share. I mean, there are certain things we have to be careful about. People could nefariously use some models, so we've made some decisions on some security things, but by and large, we are going to be forthright and transparent on everything we do. And so with that, Sina, I'll turn it back to you for questions, and we'll spend the rest of the time just answering questions.
So I've go ahead and
Michael,
turn
for the wonderful.
I'm sorry, see,
Yes,
just sound the chat feature on, so people can go ahead and start typing in their questions in the chat feature.
Thank you, Michael. And I'm going to turn to my colleague now, Dr. David Rooney, the Associate Dean of the school. David had the pleasure of having Mike as one of his students back in the early 80s when he started teaching mechanical engineering at Hofstra. So it would be suitable for him now to get an opportunity to say a few words, start with a few questions, and basically be in charge of the rest of the presentation. David.
Thank you, Sina, and thank you, Mike, for a very instructive talk there. Fascinating. Before, as I start to look at some of the comments in the chat room as they start to accumulate, maybe you could speak a little bit to the psychological climate that the airline industry is up against, the sense of fear that is perpetrated throughout the media, which earns them income but works directly against the transportation industry making income, including diminishing the number of venues that people would even bother going to because they were closed for so long, and then perpetuating the notion that airline travel is potentially dangerous for this new reason, on top of the layer of people who already didn't want to fly anyway for other reasons, and how would the airlines, starting at such a low point on the income curve because of the already very low levels of flight, how would they set aside the money to propagate some of these ideas of safety that you've been talking about? And that's a lot in one question, but maybe you could address some of those things.
Well, I think that, well, by and large, airlines in their thought process, I've talked to the COOs and heads of EM of all the US majors, as well as a large group in Europe and Asia. And I think, they know and believe that their system and the airplanes are safe. There's some data, there's a longitudinal study that CDC and Europe did around the average sick population that's sick in the world versus airplanes, and did not see a corresponding increase or decrease to the air crews. So they long-term, if I remember the numbers right, about 6% of the world's population is contagious with something at any given day. It could be a common cold, et cetera, et cetera. And by and large, that same population flies on the airplane. But but you don't see that same level in the flight attendant and pilot community, who tend to be a healthy community, which says that the airplane itself is not necessarily a spreader of disease in itself, but obviously it transports people who are sick from point A to point B. Nobody disputes that. So the airlines, I think, are a little frustrated with that. That how do they credibly tell that story? Because if they tell the story, or if we, Boeing, tell the story without data and information, we look like we're self-serving, and they don't want to do that. So they are very cautious. So they've done some sentiment analysis. That's another type of network analysis that we do and they do. And it goes to a couple of groups. If they look at their frequent flyers, most of them have said their frequent flyers are saying, look, I travel for a living. I've traveled for a living my life. Soon I just got nowhere to go. Nobody's doing business conferences. Nothing's open, and I'll get on an airplane. There's another group that says if you look at the forward bookings, they're buying tickets already for later in the year and towards next year, who are saying, I didn't go on vacation, or I didn't take my kid to a college visits, or I didn't do this. And forward bookings are actually up. So people are assuming we're going to solve it. There are people who are concerned. Clearly, anybody with an immune challenge or comorbidity is asking questions and has risk, and they should, and that's rightfully so. So they're trying to think their way through that. We're trying, because if you were to implement a change to an airplane, let's just say that the airline said, let's just say the airlines, one congressman said we should tear the center seat out of every airplane. Let's just say you were to do that. That would probably take 5-6 years to do the way the aerospace, and you can't modify 13,000 airplanes overnight. So the good news about that is the solutions can't be these long and expensive ones, right? The stuff that we look at, like self-cleaning laboratories and stuff like that, that will help the next pandemic, and that will help harden the industry for the future. But that's not going to solve what we need to do in the next year. The next year is going to be blocking and tackling and sort of elbow grease. As far as the financial conditions of the airlines, I mean, I wouldn't even want to speculate at that. I mean, losing, 80 to 90% of your revenue. I mean, we've gone out and floated bonds, and they have the CARES Act and some other things. So I think they'll get through. The good news is there will always be demand. Somebody will fly. It may just be different than it is today.
Several people in different ways brought up questions. They were fascinated by your air exchange diagram, and several people asked about, for example, practical question, is it better to have the air control coming down directly at your head or not, or does that affect in any way the air exchange that you spoke about? Yeah,
that is, what's the old show, the $64 million question? And it is not a straightforward answer. And we're working together with Airbus and Embraer and others to give a recommendation. There are a legitimate engineering discussion going on. So the individual vent on the PSU that you turn, it's called a Gasper vent. Well, the air you feel is only about 10% of that is actually coming out of that vent. What you're actually feeling is an aerodynamic effect of entrainment, where you're jetting a high velocity air, and then it's entraining other air that then gives the full effect. The easiest way to describe that is if you've ever seen these bladeless fans where they blow a little air and it creates a Venturi effect. Well, that entrainment effect. So because 90% of the air is entrained air versus actually coming out of the system, you're actually 90% of the air is coming from somewhere else in the cabin. And here's where the engineering judgment and argument, so the people on both sides are having. One school of thought is that if someone was to sneeze or cough, and if you look at the model, it looks like a cloud, if you've ever seen the CFD. Well, the good thing about the Gasper is it breaks it up. That's the side that's good. It breaks up the particles, breaks up the density. The counter argument is any particles will be entrained and directed right at your breathing space, right? And so those two competing things are going on. The other thing is those are individual passengers. So if somebody's hot, they're going to turn them on, whether we tell them to turn them off or not. And if somebody's cold, they're going to turn it off, whether we tell them to turn it on or not. And so there's so much and there's no way to lock them out. So we're sort of in the place where there's no really good, demonstrably good or demonstrably bad. So we're working with the airlines to say it really probably doesn't matter, and you could make an argument both ways. Now that's not the answer, so but I know I can't make it up.
So another person asked whether there are certain parts of the United States or in certain other countries where people will feel safer, just in this perspective, flying to and from, presumably because of what somebody else brought up in a comment about the maintenance being done, in many cases outside this country on an international flight. So do you have any comments on that? That I guess the control of the quality control at various other overseas sites for their cleaning, et cetera, versus internal.
So, okay, I saw that question. There's basically 3 levels of maintenance on an airplane. There's things that happen daily, or what's called line maintenance. There's base maintenance, and then there's heavy maintenance. What's typically done by a U.S. airline, if they do any abroad or any airline, would be what's called heavy maintenance, where you put an airplane in to a C check or a grade D check, where you're taking out the entire interior, you're inspecting for corrosion, et cetera. That's done all around the world, and people fly airplanes because there's limited places that do that. But every day, line maintenance is done at every airport in the United States. And in fact, many airlines break up their tasks and do a little each night, as opposed to taking it to a base maintenance. Some airlines would have a base, one airline, US airline, does a little line maintenance, and every 7 days the airplane hits a base so that they do base maintenance. And then obviously at an annual or further 12-year, in the heavy maintenance checks, like the 12-year checks are the things you see being where people will relocate an airplane out of the United States to go get maintenance done. So the stuff we're talking about is going to purview of line maintenance. So this is going to be the stuff that's going to be done at the gate or at the hangar that's at an airport. It's not going to be, you're not going to fly an airplane somewhere to do this, what I've been talking about. You're going to do this in situ at the gate or in an or the hangar at the airport, but you're not going to fly it somewhere to do that. So I wouldn't worry about that. Now, if the question was, if the maintenance was done somewhere, could the airplane come back with infection? Well, the life of a fomite deposit varies. That's another thing we're studying, is how that the medical community is studying how long it lives on a surface, but I don't think it would live long enough that I would worry about that perspective of it either. And now in our models, clearly, this is just logic. If you were flying from New York to LA in mid-March, that would be a much higher probability flight of transmission than if you were flying from Helena, Montana to Cheyenne, Wyoming, or something like that. Just because the population that would be getting on and off the airplane had a larger population of COVID, so your passenger selection would have larger population, as opposed to Montana in that time frame might have had 2 cases in the entire state.
Oh, one person, again, I'm not doing these in order, I'm just sort of scrolling back and forth. So if your question hasn't been picked up by me yet, or Mike, don't feel bad about it. But one person is asking about how, pardon?
Just so you know, this is all, I'm looking at them, but I'm assuming you're going to ask this
Sure,
question.
sure. So this person asked specifically about how Boeing has been impacted in terms of its production of airplanes, and also are there replacements planned for the 757, 767, which are being retired by many airlines?
The answer to that is, I mean, like everybody else, we've been impacted. I'm in our main engineering office building today, and I think there's like 3 of us in a building that probably has 4,000 or 5,000 people in it. So our entire operation from away from the factory is still virtual and telecommuting. We've also, you know, because of what's happening, what airlines have told us they're going to take for deliveries or not take. I mean, we've actually unfortunately had to have a voluntary layoff and an involuntary layoff in the near term. We believe we are still protecting for the future. Now, obviously, the 57s is in a unique situation. There really isn't a direct replacement. So some people are going to pick A320s. Some people are going to pick 737 10s. Some people are actually going to bring 787-8s into it, or A330 neos. So the 57, in my words, will be served by the best available athlete that does what the airline needs, whether it's range or passenger count, and that's the trick there. The 67 replacement, you know, already exists, which is the 787. The 787 was designed, 787-8 and 9 were designed to replace the 767. The 767 just enjoyed this incredible renaissance, and particularly in the freight market, and has had a robust, you know, second act. It's really been pretty good, and it continues on to the foreseeable future.
Here's one of those middle seat questions that you talked about briefly. So, you know, what percentage of middle seats are now filled? I'm not sure whether that really meant before or after this crisis started. And if you knew that a vaccine would be available within a year, would you look at a business model where these seats, middle seats, would remain empty?
You know, there is no business model that will keep the airplane's seats empty. I mean, there's 2 fundamental things that you sell an airplane on. Once you have the payload range and the curve, which is how far and how much you want to fly, is the economics of seat cost and the economics of trip cost. And if you take out, let's just say on a 737 or A320, you take out the middle seat, you're taking out 33% of roughly the capacity of the airplane. No airplane has that much margin. No airline or air travel system has 33% capacity change capable. The densities would be so low. I mean, the ticket prices would have to go up commensurate with that. So, and that's, the industry's never survived higher ticket prices. So I don't see a model that works there. I think the answer is really got to be about efficiency and getting to a vaccine or an antiviral or to some level that I don't know whether I don't think nature is going to take care of this one like some viruses, but and I think herd immunity is so far in the future. It's got to be a vaccine or antivirals.
Right. So
and then
go ahead.
Interdictions like masks and hand sanitizers and being careful.
Yeah. So that kind of leads to this question. How does a lot of what Boeing and the airlines themselves are trying to do rely on the regulatory agencies issuing stringent guidelines that travelers must follow, and the consequences of not following policy with regards to wearing a mask? That is, authorities waiting at the other end or needing to do a diversion and adding that to the fines on the passenger. So where's I guess the muscle behind forcing, you know, ensuring that everybody wears a mask and follow the guidelines?
Yeah, I mean, I actually think what the U.S. airlines probably the one that would get people's attention. I mean, the U.S. airlines have said, look, it's now required to wear a mask through A4A. And if you don't, we're not going to get into a fight with you in a hassle. We're going to ask you and then we're going to put you on a no-fly list, which basically says at that point you can no longer buy a ticket, and you're probably not going to get home. So that incentive there, yeah, there'll be some people that will try to challenge the system, but you know, compliance is, look, you always have to have some compliance, but you know, this should be one of those things where people should respect their fellow passenger, they should respect their fellow person, and they should respect themselves and their family. And we would hope that by informing them and educating them, that people would, if they don't like it that much, they would choose not to fly. And then I think the airlines, the U.S. airlines saying, hey, okay, if all that fails, we're just not going to let you book a ticket again. We'll discipline people. I'm not a big fan of compliance and regulation personally. I think that if you do it, you have to do it well thought and smart. Like we're looking at our design requirements for things like the air system and stuff like that. We won't make those decisions lightly. I mean, we'll understand what are the pros and cons, the unintended consequences, the intended consequences. You should make decisions thoughtfully, in my mind.
Okay. Apparently, the very specific case, a plane full of healthcare workers came to New York City from California to volunteer back in April. Has a study been completed that looked at the health status of this group or other such groups as to their health status after the trip? Do you know anything about that?
I don't know anything about that specific flight. There have been a couple of flights that IATA and ICAO had been tracking where one was from Hanoi to London, if I remember right, that had a passenger that got sick, and they were able to contact trace several of the people, and several passengers follow on. Several passengers who were on that flight had COVID at some point, but they don't, you know, obviously it's very difficult to prove it back to that index patient. And so that's one of the things that, you know, they're trying to do with the contact tracing. There's a couple of flights that the International World Health Organization and IATA and ICAO are tracking. I don't know that one, David. That's specific one.
So there are a couple of questions also that refer to people being, well, that can refer to people being screened as they enter the airport. As this one person says, disinfecting of an aircraft leaves open the issue of infected passengers. Given that proximity is going to be addressed, the greatest safety lies in caution, and it would be prudent to initially minimize air travel. I'm not sure what that person means by that, infected person, or minimize air travel in general. So let me just sort of tack on to that. Somebody comes to the airport and they have a 101 fever. Would that person be denied flight? Even that 101 fever could be due to a strep sore throat or something.
There are regulatory agencies around the world who are looking at passenger screening. I know that I don't know the specifics of it. I know they did it in some of the countries in Asia. There are a couple other places looking at it. I mean, I think that that you just hit the nail on the head. I mean, you know, you could have a fever for a number of reasons. I think in this environment, I mean, if I got to the airport and I had 100.4 fever, 101 fever, and they said, look, you can't fly, I mean, I personally would respect that. You know, I'm not sure what 101 fever I'd want to get on an airplane, but
yeah, right.
I think there might be someone. What we're assuming in our modeling that there is an index patient, or there are index patients on the airplane, and that's the basis of what we're trying to do in terms of understanding how it responds. Simply because we don't know the number, and I don't think anyone really knows the number of how many people are asymptomatic and contagious with a viral load. The data the information we've been getting from the medical community has told us, nominally in our model, we say someone is exposed, If they're going to be symptomatic, it's about median 4 days to 4+ days to symptoms. At about 0.6 days before you're symptomatic, you're most contagious. You're contagious through day 16 nominally, I think it is, and then you're recovering through day 21, I think is the total cycle. But as you know from the antibody testing, other things, you're shedding virus. You can be shedding virus for a long time after that, but it's not capable of being contagious. And so there's a window, and so that's where some of these tests become problematic. Is that they don't necessarily say that they could say you've been exposed to it, but they don't necessarily say, or that you're shedding, but you don't know whether it's contagious or not. So we're in our modeling assuming that there's a contagious person to try to protect people. And like, for example, people talk about, the thought process between, say, no center seat or something like that is social distancing. Well, social distancing from an engineering point of view is a design solution, right? Somebody in the medical community sat down and said, okay, we want to keep the R naught at 1.0 or less. So in rough, an R naught is like a lot of things in the scientific community. People debate it, but an R naught of 1, the disease is neither growing nor dying. Less than 1, it's not replicating. Greater than 1, it's replicating. At its peak in March, and when you guys were going through the worst of it in New York, the R naught in the United States was about 4.5. It's currently at about 1.2. That's why we say we'd like to get the ratio below 1 for the travel experience. That way we'd say we are doing no harm. And so we assume that people are in that situation, and we're trying to put the countermeasures in, or the ways that people can be safe. The 6 foot was doctors saying, how can we manage the R naught? And they were doing it for good reasons, ICU beds and hospital capacity and medical capacity or medical staff capacity. But that was a design solution. You and I know that I could be in a NASA EVA spacesuit, and you and I could be sitting 2 inches for each other, as long as those life supports were independent, and we're not going to spread each other, right? So those are different. That's an extreme design solution, right? And so we're trying to figure out things like a mask and sanitizer, and what's the right formula for the airplane environment.
Right. And also, of course, some European countries used a 1 meter distance as well, so that the 6 feet wasn't a universal thing. So are you aware of an organization, EASA? A viewer says that they're carrying on epidemiological studies on the probability of transmission on board a plane.
Yeah, EASA is the European equivalent of the FAA.
Yeah.
And we're working with them. We talk to them pretty much every day.
Okay. Another person says Ben Gurion University in Israel just announced a near instantaneous COVID test using a relatively inexpensive electromagnetic based device. Have you heard anything about that yet?
I'm not familiar with that specific one. I know there are a number of universities and companies working on quick turn tests, but I'm going to actually write that one down and ask my team to look into it.
Sure. Okay. And then there's a more generic question: as Boeing continues to build larger and larger aircraft to carry more passengers, isn't the risk of infection going to increase in the event of any future epidemic?
That person has confused with Airbus. Boeing our strategy for the last 20 years has been smaller, super efficient airplanes flying point to point, which was the 787. Our competitors' strategy to deal with congestion was the very large A380. Right. So I'm not negative on big airplanes or small airplanes. I love them all, but I also love super efficient small ones called 787.
Yeah. We still have some 45-year-old 747s out there, right?
Oh, we have some brand new ones sitting on the tarmac right about 500 yards from my office here, getting ready to be delivered as freighters. So, yes.
Okay. Yeah. So this person, it's David Weissman, whom I think you know. He said he's going to send you some information on the Ben Gurion studies. So
Awesome.
let me see. Is that Sina? Did you want to, since you have obviously a very strong medical interest, do you want to ask a question or so?
No, I think, Mike, to follow up on one of the questions, if a vaccine is not available for, let's say, another year, and as one of the questioners was asking, a rapid test does become available, do you foresee the possibility of 4 to 6 months from now, everybody needs to get tested right before boarding on a plane?
I mean, if hypothetically, if we had an ability to test somebody, and now I'm not a doctor, remember, and I don't even play one on TV. I'm an engineer. So I'm going to say if there was a test that could show that somebody was infected, and then the next question is that was actually shedding a contagious viral load, that it wasn't, because you're still shedding virus 30, 40 days after you've had this. You're just not contagious anymore, right? So you want to get those they're not false. You don't want to inadvertently screen those people. But if you could screen somebody instantly, and it could be economically and quickly done, where there was no hassle factor for people, where, I've seen schemes where people say you go to a screening A, and if you fail that, you go to a screening B, and then screening A might be a temperature test, and then the screening B is a rapid test. Well, how many hours do you have to go to the airport before you want to fly if you have to go through another hour of potential medical screening, right? So that becomes the hassle factor. Now, that really, but if that's what it would take to restore the industry, think about the parallels we draw as to September 11th. September 11th was a tragedy. We had a lot of things that were done, where people's luggage were being completely unpacked and people were being pulled out and screened, and there was a huge hassle factor early on. The TSA eventually figured out how to do it. They brought technology along now. Pretty much everybody in the world knows what to expect when you go through a screening now, and the standard is much higher than it was pre-September 11th, and the hassle factor has gone down, right? So we would figure it out, and I mean, if we could do it, I mean, and you could ensure people that they could fly, I'd be supportive of that.
Again, unless there's any other questions, I would like to again thank Mike for such an informative presentation. This was the second presentation in our summer executive lecture series. 2 weeks ago, we had another alumni, Ron Piervincenzi, who happened in that case be an old student of mine, presented on drug safety. And again, in 2 weeks from now, as Carrie Ann will be sharing the information with everyone, there's going to be a presentation by another alumni who's going to talk about 5G network and the safety of the data you are using, and the issues between problem created by a Chinese company called Huawei being basically taking center stage in this area. So we hope to have these presentations, at least 2 more of them during the month of July. And if there's anything else, if Carrie Ann would like to end the session by informing others how they would hear about this presentation, I want to take the opportunity again on my behalf and behalf of the faculty and staff and students at the DeMatteis School and Hofstra University to thank Mike for his time and for the informative presentation that he gave us this evening.